Hello viewers, welcome to my channel. I am not a panda. This is just an animation signifying that I don't think I'm good looking. I'm hiding behind this avatar because I have received fairly unfavorable feedback regarding my appearance. So while I'm working on my appearance, I shall be hiding behind this avatar for the meantime. As promised in the previous videos, I will be uploading videos each day of the week and each video will follow a theme. The theme for Monday was MS ENT and the theme for Tuesday was MBBS. So no prizes for guessing. The theme for Wednesday is MRCS. More specifically, MRCS ENT OSCE. Now before you tune out, I must reiterate that the syllabus for all ENT assessments are generally the same, whether it is MBBS exam or MS exam or even MRCS exam. It's just that the expectations from the examinees keep changing. Sometimes you are expected to answer everything, and sometimes you are expected to answer less than everything. But the syllabus, the knowledge, and the general approach towards the exam generally remains the same. At least that is what I have experienced over the years because I have taken all these three exams. More pertinent is the advent of the new regulations introduced by National Medical Council. So I would suggest that there is a lot of similarity between the MBBS ENT university exam and the MRCS ENT OSCE because of the new regulations introduced by National Medical Council. And in case you don't know, the eligibility criteria for MRCS is not MSENT, it is an MBBS degree. So I firmly believe that if you have an MBBS degree, you are not only eligible for MRCS ENT, you are also in possession of the required knowledge and skills to pass MRCS ENT comfortably. So without further ado, today's discussion is going to be about how to obtain informed consent. It will be a practice with Pushpen video featuring Dr. Pritha Ghosh. And in today's video, I will be practicing how to obtain informed consent for total thyroidectomy. Generally, I do not record my feedback because it is not fair to the person I'm practicing with, but I will give a generalized feedback at the end, which is not directed at any individual. It is generally the feedback related to how you should talk about obtaining informed consent, especially the risks associated with total thyroidectomy that you should highlight while obtaining consent. So without further ado, let's get into the meat of the discussion and let's welcome Dr. Pritha Ghosh for the practice with Pushpen session. Hello viewers, welcome to Practice with Pushpen. This is the video edition. You can see my face. I am Dr. Puspen Dasgupta and Dr. Pritha Ghosh has graciously joined us. She will soon be appearing in MRCS ENT OSCE, and it is of paramount importance that if you want to pass MRCS ENT OSCE in your very first attempt, then you should practice communication skill stations as much as possible, preferably daily, and preferably with a person who is appearing in the same session with you. If not, find someone who has their interests aligned with yours. And as long as your practice sessions are serious and you are trying to get to the right answers in the right time and expressing yourself in the right way, as if you are talking to a patient, you should be fine. But I do believe that this is the station, these are the stations where the wheat is separated from the chaff. And as international students, people trained overseas, this is the place where we are at a slight disadvantage compared to the UK doctors. But with the right amount of practice, I think we can really not leave any lacuna in our preparation. So with that out of the way, for the benefit of the viewers, in this video, we will just record the practice session. The feedback session will not be recorded. The question will not be shown while communicating because even during your MRCS ENT OSCE, you will not be allowed to look at either the question or the time. So you might get 7 minutes prep station where you can prepare yourself
regarding how you will approach the station. It might be an examination station, it might be a history taking station, it might be an informed consent station like this one is. So I'll just read the questions for the benefit of the viewers, and then we'll start the timer of 7 minutes. So in this situation, I will play the role of a 45-year-old man who is complaining of midline neck swelling. Investigations have been done. It reveals it to be U5 and Pi5. Now, these terms should make sense to you. Otherwise, you'll not be able to understand what the disease is. And sometimes the disease is not explicitly mentioned in the question. You have to figure it out from the clues given in the question, and then you'll know what surgery is the required procedure in this case. So in this case, you have to figure out the disease and the surgical procedure and then obtain informed consent for it. Dr. Pritha Ghosh, are you ready?
Yes.
Okay. So your time starts now.
Hello, I'm Dr. Pritha Ghosh, and I'm one of the ENT doctors in this hospital. May I speak with you?
Hello, doctor. Yes, you can speak with me.
Could you please tell me your name and date of birth, please?
Yes, so my name is Matthew Smith, and I am 45 years old.
And how may I address you, sir?
You can call me Matthew.
All right, Matthew. I see that you were having a swelling in the middle of your neck, in front of your neck, and some tests and a needle biopsy was done. Well, I was just wondering what you already know about your condition, or any procedure was suggested to you?
Yes, but I just want to know, is FNAC same as needle biopsy?
Yes, it is.
Okay, yes. So yes, that was done. And I was told that in all likelihood, I have cancer of the thyroid gland. So is that true?
Well, I'm so sorry to say that, but unfortunately, the reports do say that you have the cancer of the thyroid gland.
So I was told that I require a surgery for that. And I was just wondering if the entire thyroid gland should be removed, or just like half of it.
Well, the reports that have come after the needle biopsy and the scanning say that it is confirmatory of cancer of the thyroid gland, and the best option for treatment here is removing the total of the thyroid gland. So
But
I am here.
I just wanted to know, if you remove my entire thyroid gland, how will it affect my body?
Well, I will be telling you in details about the function of the gland and the procedure, which are actually important for you to know, and it will help you in making a decision. And if you have any queries in between, please feel free to ask me. All right?
Yeah, I think I already asked you a query.
Yeah. So here the thyroid gland is situated anteriorly in the middle of the neck. It is a butterfly-shaped gland, and it actually helps in the metabolism of our body. So it is actually related to many important structures, which I will be telling you a bit later. So since you have been diagnosed with cancer of the thyroid, according to the reports, which I'm very sorry to tell you again, so we are suggesting a surgery known as total thyroidectomy, which will require us to remove the entire thyroid gland. Are you following?
Yes, I do understand that. But if you remove the entire thyroid gland, how will the function of the thyroid gland be compensated for?
Well, for that, we will be giving you supplements, medications, which you will have to take lifelong. That will help in actually compensating for the gland that has been removed.
That makes sense.
So moving on. All right. So moving on to the procedure, here we will be actually doing it under a general anesthesia, where you will be asleep throughout the procedure. And any questions regarding the anesthesia, we'll set a meeting with the anesthesiologist, and there you can ask them any questions. And for this general anesthesia, you have to fast a few hours before and after the surgery. As for the procedure, we will be giving skin cuts in your neck, and then we will carefully remove the whole of the gland, and we will try to, depending on the extent, we will try to preserve as many important structures as we can. And then after the surgery, we will be insert some tubes under your skin and repairing the wound. And these tubes are actually known as drains that will help in removing any collection that might happen under the skin. Does that make sense?
Collection of what?
Maybe blood or some kind of discharge that might happen after removing the gland, bodily fluids.
Okay. And how long will these drains be there?
Well, these drains will be there for about 24 to 48 hours, and therefore you have to stay with us for about 24 to 48 hours unless we remove the drain.
Mm-hmm. Okay.
All right. So the benefits of this procedure is that you will get rid, it will be a therapeutic measure where you will get rid of the cancer. And also we will be sending this thyroid gland for examination under the microscope, where we will be certain of what the disease is and what type of the disease it is. Does that make sense?
I have a question here. Can you tell me what type of thyroid cancer it is?
Well, this is basically papillary cancer
Papillary.
of the.
Okay. Okay. And so, will you need to remove anything else apart from the thyroid gland?
Yes, with the thyroid gland, since it is papillary, we will be removing the neck nodes, the lymph nodes that are there with this.
Okay. So would that have any risks?
Yes, there are some risks associated with this procedure. Like there could be bleeding, there could be wound infection, and there could be scar formation.
Okay.
These are the general complications that occur, and then there are complications that happen with the thyroid surgery. Like there could be some alteration in your voice because there are nerves that help in voice production, which are closely related to the thyroid gland. And then there are parathyroid glands, which actually help in the calcium metabolism. So sometimes while removing the thyroid gland, these glands could be affected, leading to hypocalcemia. So we will take utmost precautions so that these complications do not happen. And if it does happen, we will supplement you with calcium as well. And as I have previously mentioned, that they could, as we will be removing the whole of your thyroid gland, we will be giving you thyroid supplements for the rest of your life.
Okay.
And I'm really sorry to say that there is no alternative to this procedure. And the precautions that you have to take is you have to be off work for about 2 weeks. You cannot do any kind of strenuous activity during that time. And that's about it. And you will have to come up for follow-up after 10 days so that we can tell you the reports of the biopsy or the reports that we send and for treatment of the wound.
So, I am a professional singer. Would this surgery in any way hamper my profession?
Well, yes, it could. As I said, that there are nerves that help in voice production, which are closely related to the gland. But we
Okay,
will
so
take
that
utmost
is the
precaution.
time. That is the time. It's pretty good. And as I said, the feedback will not be recorded. But again, the feedback should be very honest and very helpful. You should be kind to the person you're preparing with, because you should ideally prepare more than once. So with that out of the way, thank you so much, Dr. Prisa Ghosh, for practicing. I think it was good effort.
I know it must be frustrating for some viewers that I am not giving my feedback for the practice sessions. And maybe ideally, I should practice in a manner which is something you can replicate exactly if the question comes in your exam, and that would fetch you the best marks that you possibly could get. But it is very difficult to achieve because, as you can understand yourself, if you're preparing for MRCS ENT OSCE, it is very difficult to remember everything and to say everything in those 7 minutes with the right expressions. It is a very uh, unnerving situation, and I have to acknowledge that, having been through it myself. But it is imperative that you keep trying to achieve perfection, and perfection only comes with practice. So I don't really want to uh, broadcast my feedback to individuals on YouTube, but it is very important to remember exactly what you're supposed to say based on the scenario that you encounter. So based on this scenario where you have to take consent for total thyroidectomy, it is very important to explain to the patient the unique risks that are associated with total thyroidectomy specifically. Of course, every surgical procedure has risks of bleeding, infection, ugly scar formation, All of that is there. But what are the specific risks of total thyroidectomy? One of the most important risks, of course, is recurrence of disease, because any malignancy can recur. Although thyroid malignancies, especially papillary thyroid carcinoma, typically has very good prognosis, but there is a non-zero chance of disease recurrence, so you should tell the patient about it. There is, of course, the chance of alteration of voice because the recurrent laryngeal nerve does lie close to the thyroid gland. So, and any damage to the recurrent laryngeal nerve can lead to alteration of voice. Superior laryngeal nerve, the external branch of superior laryngeal nerve, controls the pitch of the voice, which is particularly important for professional singers. Hypocalcemia is also a possibility because parathyroid gland can be injured or the vascular supply to the parathyroid gland can be compromised during thyroid surgery. Sometimes the parathyroid gland lies within the substance of the thyroid gland, and in those cases, it is very important to make sure that you can dissect the parathyroid gland out and re-implant it into the body if possible, because hypocalcemia, I feel, is probably one of the most uh, morbid conditions that a patient can have following thyroid surgery. It is much more morbid than alteration of voice. Hypothyroidism, of course, is a possibility after total thyroidectomy because you're removing the entire thyroid gland. So patient has to be made aware of that fact that hypothyroidism will in all likelihood develop following following total thyroidectomy, and he or she will be receiving thyroid hormone supplementation following the surgery. Another thing that should be pointed out to the patient before while taking consent is the need for further surgical procedures. For example, if the patient has persistent hoarseness of voice, maybe they might have to undergo something called a thyroplasty, or maybe neck dissection might be planned at a later date. So further surgical procedures can be required, although typically it is not commonly seen following thyroid surgery, because as I said, thyroid surgery, thyroidectomy especially, in case of the papillary thyroid cancer, has a particularly good prognosis. And tracheostomy. Tracheostomy is particularly important to mention to the patient because if there is bilateral recurrent laryngeal nerve injury, or one side of the recurrent laryngeal nerve was injured beforehand and the other side is injured during the surgery, then the patient will have difficulty breathing following the surgery and would require an emergency tracheostomy. So that also has to be something one needs to explain to the patient while taking consent for total thyroidectomy. So this is my rudimentary feedback for total thyroidectomy, and I hope this will benefit the viewers, and I hope you like the video edition of Practice with Pushpen. If you have any preferences, if you prefer the audio version, then please feel free to mention it in the comment section below, or if you prefer the video version, then please feel free to mention that as well in the comment section below. Thank you so much for watching. I hope I was able to help you. If you have any questions, please feel free to write it down in the comment section below. And these videos are just for you. And again, I'm trying my best to make it as helpful for you. But of course, I'm sure there are some things that I am missing out on. And it is my endeavor to help you as much as I can, because I received a lot of help from people all over the world. And thank you once again for watching. If you want to reach out to me on Instagram, this is my Instagram handle, Dasgupta Pushpen, and I'll be happy to answer any of your queries there. Take care. I hope I'll get to see you again in the next video very, very soon. Bye-bye.